How to improve your balance. Hi, my name is Doug. I've been a physical therapist for 30 years, and I specialize in balance problems and helping people learn to walk again. This video is a complete program in regaining your balance. If you've had trouble with your walking, if you're falling, if you find that you're using a walker or cane just to get around, this video is for you. In this video, I'm going to show you 21 exercises that can help you build up your strength and improve your balance. To do heel-to-toe standing, you just need something sturdy in front of you. You can use your kitchen sink, a countertop, or the back of a chair. You want to stand up, and then you want to put your feet in the heel-to-toe position. That means one foot in front of the other with your heel touching your toe. Now you want to stand up straight, facing forward, with both hands on whatever you're holding on to. Then you want to try to let go. Now at first, this might be very difficult. For people that are not walking at all, this can be quite a challenge. You might only be able to let go for a couple of seconds before you have to grab back on. What you want to try to do is keep building the amount of time that you've let go. You want to let go for longer and longer. So you want to try to let go, hold it for a few seconds, and then grab back on. Your goal is to try to let go for 20 seconds with each leg forward. So 20 seconds with the right leg forward and then 20 seconds with the left leg forward. Once you can do that, then you've achieved what this exercise is supposed to do for you. You don't have to do it beyond 20 seconds. But for many people that are unable to walk or who are barely walking, 20 seconds is a huge challenge. The next exercise is called hamstring curls. To do this, you want to be standing up and holding on to something to keep your balance. Then you want to bend your knee up behind you like you're trying to kick your bottom. So you want to lift your leg up as high as it'll go, and what that's doing is tightening the hamstring muscle. You want to hold it for a second and bring it back down, and then do the other leg. Your goal for this exercise is to do 20 repetitions on each leg for 3 sets. But in the beginning, you might only be able to do 5 or 6 repetitions for 3 sets. You want to slowly build yourself up over time. Don't feel bad if you can't do 3 sets of 20 in the beginning. That's your goal. In standing, with your hands on something like a countertop or the back of a chair, you want to lift your leg up in the air. Now your goal for doing this is to do 3 sets of 20 repetitions. But in the beginning, most people find that they can only do 5 to 8 repetitions. It's a hard exercise. You want to lift your leg up, holding it up for about 1 second, and then bring it back down to the ground, and then lift the other leg up. So you want to alternate right leg, left leg. Over time, over the course of doing this every single day for a few weeks, you want to build up to doing 3 sets of 20 repetitions. To do this exercise, you want to be standing and holding onto the countertop. And what you're going to do is raise up like you're raising up onto your toes. Some people call it raising on their tippy toes. You want to rise up, stand on your toes for 1 or 2 seconds, and then come back down to the ground. You want to repeat this 10 times in a row. So the goal of this exercise is to be able to do it 3 sets of 10 reps. That means doing it 10 times, then pausing for about a minute, then doing it 10 more times, then pausing for a minute and doing it 10 times. 3 sets of 10. But it's perfectly fine when you begin this exercise just to do a few repetitions. A lot of people are going to try this and find that they can only go up and down maybe 1 or 2 times. That's fine. Do 3 sets of 1 or 2 times. What you want to try to do is build up. Each time you do the exercise, try to do 1 more repetition or 2 more repetitions. The goal is 3 sets of 10, but it may take you a few weeks to reach that goal. Leg kicks. You just want to get in a chair and sit up straight and slowly kick one leg up until it's all the way straight. Hold it for about 2 seconds and then bring it back down, then lift up the opposite leg. You want to go back and forth with each leg. Your goal with this exercise is to do 20 reps for 3 sets. That means doing 20 repetitions, resting for a minute, 20 more, resting for a minute, and 20 more. I recommend that you do this exercise once a day. Wall push-ups. Now to do this exercise, you want to have both hands on the wall and you're leaning onto the wall. Now it's really important where you place your feet. To make it easier, you want your feet closer to the wall. To make it harder, you want your feet further away. It's really up to you and your ability level where you're going to place your feet, but I recommend that you're at least 18 inches away from the wall so that you're leaning forward slightly. Then with both hands on the wall, you want to start off in the push-up position, and then you bend your elbows, bringing your body closer to the wall. As you bring your body closer to the wall, you want to be exhaling. And then as you push away from the wall, that's when you want to inhale. So you want to try to control your breath to get the most out of this core strengthening exercise. You want to do it slowly, and you want to build up to 3 sets of 20 repetitions. But in the beginning, you might only be doing 3 sets of 5 reps. This is a great core exercise, but you want to start it off slow. With both hands on a countertop, you want to simply step to the side. It's almost as if you're lifting your legs off the ground, as if you're stepping over something, but you're not stepping over anything, you're just moving your legs to the side. You want to keep repeating this with you holding the countertop. The goal of this exercise is to do this 3 times to the right and 3 times to the left without holding on. But in the beginning, you're going to be holding onto the countertop a lot. The first few times you do it, you might just be sliding your hands along the countertop. But over time, as your balance gets better and you get more confident, you want to start to let go of the countertop, working towards the goal of not holding on at all. It's always advisable when you do this exercise to keep your hands over the countertop just in case you lose your balance. To do a weight shift, you need something sturdy next to you. You can use a countertop, a bar, even the kitchen sink, something sturdy to hold on to. And what you want to do is put all your weight on one leg, bringing your other leg off the ground, and then put all your weight on the other leg, bringing the opposite leg off the ground. It kind of looks like you're dancing. You're going to sway to the right, sway to the left. It's very difficult to get your foot off the ground when you do it, so you might need to hang on to the countertop the first few times you practice it. But this is an exercise that doesn't really work unless you're letting go of the countertop. So go as slow as you want, but you want to be able to let go of the countertop and bring one foot off the ground as you put all your weight on the other leg. This exercise helps you learn how to shift your weight. Most people who have trouble standing on one leg can't do it because they're not willing to shift their weight. So this is a great way of practicing weight shift without risking a fall. You want to have the countertop next to you the whole time, but try not to hold it. The goal is to do this 3 times in each direction. So 3 times to the right and 3 times to the left. With both hands on the countertop, you want to shift your weight over one leg, lifting the other leg off the ground, and then try to let go of the countertop, balancing for as long as you can. So you want to do the right leg and then shift over to the left leg. And you keep repeating it. The goal of this exercise is to do it for 20 seconds on each leg 3 times in a row. So that means standing on the right leg for 20 seconds, repeating that 3 times without holding the countertop, and then do it on the left leg 3 times for 20 seconds without holding the countertop. In the beginning, you're going to be holding the countertop quite a bit. In fact, most people when they do this exercise find that they can only stand for 1 second, maybe not even a full second, before they have to grab back on. Don't let that discourage you. Most people have trouble with this exercise. The reason they have trouble is because they're not fully shifting their weight over the leg they're standing on. If you find that you can't do this for even 1 second, I'm almost positive it's because you're not shifting your weight. So what you want to do is grab the countertop with both hands and fully shift your weight over one leg. You should feel balanced when you do this. When you fully shift, you're going to get to a place where you feel that it's a little bit easier to stand there. That's when you want to let go of the countertop and try to maintain that position. To do pillow squats, you need a sturdy and safe chair. If it has armrests, that makes it even easier, but it doesn't have to. You also need 1 or 2 pillows. If you find that you're very weak and standing up from a chair is extremely difficult for you without holding onto the chair, I suggest starting with 2 pillows. The way you want to do the exercise is without holding on, try to stand up and sit back down on the pillows. You don't want to do this too quickly, and you don't want to bounce when you come down. So you want to stand up and then sit down gently on the pillows. The goal of this exercise is to do 3 sets of 10 repetitions, resting about 1 minute between each set. A lot of people are not going to be able to do this exercise without pushing with their hands, and that's fine. In the beginning, it's fine if you have to push your hands on the seat of the chair or on the armrest to help yourself stand up. What's important is that over time, you use your hands less and less. Over time, the goal is to do this without holding on at all. You can even cross your hands over your chest to keep you from using your hands on the armrests. What's really important is trying to do this for 3 sets of 10 repetitions. To do heel to toe walking, you want to have 1 hand on a countertop. Then you're going to walk heel to toe, which means walk so that the heel of the foot that's forward touches the toe of the foot that's behind. So it looks like you're walking on a tightrope. Now, some people find that it's easier to have a tape line or some kind of mark on the ground to walk along to help them walk heel to toe, but you don't have to have that. You can simply walk with your heel of the forward foot touching the toe of the backward foot. The goal of this exercise is to walk 3 to 4 steps in each direction without holding the countertop, repeating that 3 times. So walking heel to toe in one direction, 3 steps, turn around the other direction, repeating that process 3 times without holding the countertop. Now in the beginning, you're probably going to be holding the countertop the entire time, and that's fine. That's how we regain our balance. We challenge ourselves. What you want to do is, after you get some confidence, is start to let go of the countertop occasionally. Then try to let go of the countertop more and more. Maybe as you take each step, try to let go and only grab on if you lose your balance. You need to struggle to do this without holding the countertop at all, but you have to progress to that. So it's perfectly fine if you touch the countertop in the beginning, but the more you practice it, the more you should be letting go. With 1 hand on the countertop, you're simply going to walk backwards. This just means walking like you normally do forward, 1 foot in front of the other, but you're only going to be moving backwards. You should only go 2 to 3 steps because you don't want to get away from your countertop. After you go 2 to 3 steps, you're going to turn around and walk in the other direction 2 to 3 steps with your hand on the countertop. Now the goal of this exercise is to walk 2 to 3 steps in both directions, repeating that 3 times without holding the countertop. But in the beginning, you're going to find that you're going to have to grab the countertop every so often. In fact, the first few times you do this, you may be holding the countertop the entire time. Over time, your balance will get better and you can let go of the countertop more and more. You want to work towards the goal of being able to let go of the countertop the entire time that you're walking backwards. The second exercise is called stepovers. To do a step over, you need something to step over. You can use a towel, you can use a line on the ground, or even an object. You want to have something nearby to hold on to, like the back of a chair, the countertop, a kitchen sink. And what you want to do is simply step over with both feet in one direction and then step back in the other direction. So you're going to go to the right with both feet and then to the left with both feet. You do need to leave yourself room for your foot to hit the ground. So if your right leg is coming over, you have to bring it far enough over that there's room for your left leg and vice versa. The goal for this exercise is to be able to do it 3 times in each direction without holding the countertop. But in the beginning, it's perfectly fine to hold the countertop the entire time. As you get better at this, you can let go more and more until you reach the goal of being able to do it 3 times in each direction without holding on. Now to do this, you need a chair with armrests, and you need that chair to be against something to make it secure. So you can just push it up against a wall. What you do is you bend forward, putting both your hands on the armrest of the chair, and then you simply hold that position. Now some people call this a plank, and you'll see people doing this on the ground, and it's a great exercise at building upper body strength. It's an isometric exercise, meaning you don't move when you do it, you just simply hold the position. Now, the further your feet are from the chair, the harder this is going to get. But be careful, because if you bring your feet back too far, it could result in you falling. So only bring your feet back as far as you're comfortable. To do this exercise, you want to just time how long you can hold that position. You want to probably start with 10 seconds and then build up to a goal of 30 seconds. So you want to hold that position for 30 seconds. And doing that will build your upper body strength. To do tapping on a step safely, you're going to need 2 things. One is you need something to tap. It could be a piece of tape on the floor, or it could be an aerobic step, or anything that is easy for you to tap. The other thing is you're going to need 1 or 2 things to hold on to. You can use the back of 2 chairs, you can use a countertop in a chair. I recommend having something on your right and your left when you do this exercise. Now to do the exercise, you want to tap your foot forward onto the object, just tapping your foot. So tap your right foot, then tap your left foot. You're not putting any pressure on the thing you're tapping onto. So you're just standing, lifting one leg off the ground, bringing it forward, tapping it, then putting that foot down and going on to the other leg. So you're going to go right leg tap, left leg tap, right leg tap, left leg tap. The goal of this exercise is to do it 20 times on each leg without holding on. But in the beginning, you're going to need to hold on. You might find that you're losing your balance the entire time. That's okay. Hold on if you need to the first few times that you do it. But what you want to try to do is let go when you're doing the tap. This exercise is not really beneficial if you're holding on the whole time, because you're not going to shift your weight. The purpose of these exercises is to teach you to shift your weight over the leg you're standing on. That's going to help your walking and improve your balance. So you want to be letting go while you're shifting to the right and tapping your left foot, letting go while you're shifting to the left and tapping your right foot. But it's okay if occasionally you grab onto the chairs to steady yourself. You don't want to fall while you're doing this exercise. You want to keep practicing this every day until you can get good enough to reach your goal. Now a balance mat is just a really soft cushion. You can use a couch cushion or a chair cushion, anything that's soft and spongy that when you stand on it, you feel unsteady. Now again, you want to use a countertop or the back of a chair to be careful and steady yourself when you get onto this. With both hands on the countertop, you want to stand so your feet are close together on the cushion. Then you want to let go of the cushion. You're going to feel very unsteady at first, and you're probably going to grab right back onto the countertop. But you want to keep doing this. Keep trying to stand without holding the countertop, but your hands just over it just in case. The goal is to stand for 20 or 30 seconds without holding on, with your feet close together. Now to do this safely, you're going to want to have something next to you to hold on to. I recommend a countertop, the edge of your sink. It could be a heavy chair turned backwards, anything that's secure. You want to put one hand on this while you start doing this exercise. Now, what you want to do is just simply step forward over that object. Then, once you get both feet over, you want to step backwards over the object. You want to just keep repeating this. I recommend doing this for about 5 minutes, 1 to 2 times a day to see an improvement. When you're doing it, you want to make sure that your feet are getting completely over the object. Try not to touch the object. Try not to drag your feet on it. You want to step cleanly over it. Now, as you get better, you can start to let go of whatever you're holding on to and just keep your hand there for safety. Your goal is to be able to do this 20 times forward and backwards. So that means stepping forward and then backwards over this object 20 times without holding on. Now, it may take weeks, if not months, for you to be strong enough and have the balance to do this. This activity improves your balance, your proprioception, and your leg strength. It's a great exercise, and it's an excellent way to reduce your chance of falling. To do this exercise, you're going to need 2 things. You want to have something to hold on to steady yourself, and you also need a step. I use an aerobic step that I purchased from the store, but you can use anything that's sturdy. You can use a single block of wood that's about 3 inches tall, a piece of concrete. You can even use a stair inside your house as long as it's not too tall. I would recommend that your step be at least 3 inches, but at the maximum it should be 6 inches tall. Now, to do this exercise, you want to grab onto something to hold on to and then step up on your right leg, bringing your left leg up on the step as well. Then you want to step backwards with the right leg till you're back on the ground. You want to repeat that 10 times on each leg. The goal of this exercise is to step onto the right leg 10 times and then to the left leg 10 times without holding the rail. But in the beginning, you're definitely going to be holding the rail, and you might not even be doing 10 steps. It's perfectly okay just to do 1 or 2 steps in the beginning if it's really fatiguing. You can also use the rail to steady yourself and even help yourself get up onto the step. This is a great exercise that will improve your strength and your balance, so don't feel bad if you have to hold on for the first few times that you do the exercise. What's important is that you work towards letting go completely. What we want is for you to be able to walk up on top of a step without holding anything. Just have your hand nearby the rail just in case you lose your balance. Leg lift chair plank. Now, to do this, you can either use the armrests of a chair or you can use the back of a couch or the back of a heavy chair. You want to have both hands on the back of the chair. You're again in this push-up position with your feet out behind you. And what you're going to do is you're going to alternate leg lift as you're in this position. So you're going to lift one leg up. As you do, you're going to exhale and try to hold your leg up for 5 seconds. Then you put that leg down and then you lift the other leg up, holding it up for 5 seconds. Your goal is to build up to 3 sets of 20 repetitions, holding it for 5 seconds each rep on each leg. Now, to do this exercise, you're going to need 2 things. One is a step, and the other is something to hold on to that's sturdy. I'm using an aerobic step and a countertop. But if you want, you can use a stair in your home as long as there's a rail next to the stairs for you to grab onto. What you want to do is stand on the step facing down. Then you want to step forward with one leg, putting your foot on the ground, and then bring the other leg onto the ground. So you're stepping down onto the right leg first, then backward step back up onto the step with the same leg. So step down with the right, and then step backwards up on the right. Your goal with this exercise is to repeat it 10 times on each leg. So 10 times you're going to step down on the right leg and back up, and then 10 times on the left leg, down and up. You want to do this as a goal without holding on. But in the beginning, this is a difficult exercise. It's especially hard to step backwards up onto a step. It takes a lot of strength. So it's fine to grab onto the rail when you practice it. It's also important, if you're struggling, to use the lowest step possible. For some people, 3 inches is the most they can step up without having too much trouble or without having to grab onto the rail. It's better to do this on a lower step in the beginning so that you can do it repeatedly as you build your strength. Then as you get stronger, you can progress to a taller step. The goal again is to use a 6-inch step and be able to step up and down 10 times with each leg leading. To do this exercise, you want to have both hands on the countertop, and you should be standing with one leg off the ground. Then you're going to raise up on top of your toes on the leg you're standing on, holding for about 2 seconds and then coming back to the ground. You want to repeat this 10 times. The goal of this exercise is to do 3 sets of 10 reps on each leg. So 3 sets of 10 with the right leg on the ground and 3 sets of 10 with the left leg on the ground. You want to rest about 1 minute in between each set. Now this is a difficult exercise, and in the beginning you might not be able to do very many repetitions. You might start off just doing 5 repetitions for 3 sets and then build that up over time to 10 repetitions for 3 sets. This program is designed to be done in order. I've organized these exercises from the easiest to the most difficult. So the way you want to do this is to start with the first exercise. If you're having trouble with that, keep doing the first exercise until you find it easy and then move to exercise 2. The last exercises are the most difficult, and you only want to do those once you've mastered the beginning exercises. So as much as you can, try to do this program in order. Most people, this is going to take weeks, if not months, to really gain their balance back. So be patient. What is balance? Many people really don't have a good answer to that question, but most people know when they're losing their balance. The truth is, many seniors have trouble with their balance. They might be shuffling when they walk. They might have to use a walker or cane just to feel stable. A lot of people have trouble with their balance, but they don't know really how to answer the question of what is balance. So there's really 2 ways to think of balance. There's functional balance, which means if I measured your balance, if I tested your balance, how good is your actual balance? But then there's another thing called perceptual balance. Perceptual balance is how balanced we feel. So I'm going to start with perceptual balance. You know when you're feeling balanced. You can tell when you're walking if you feel stable or if you feel like you're about to fall. So what part of the brain is this all happening in? It turns out there's one region of the brain that's located in the temporal lobe, and that region tells your frontal lobe that you're balanced. You can think of it as whole body awareness. When that part of your brain tells your frontal lobe, yes, I'm completely stable and balanced, then the person feels balanced. The thing is, a lot of things have input into that region of the brain. Now, many people will talk about the inner ear. In the inner ear, there's an organ that tells your brain when you're accelerating in one direction. So if you tilt your head to the right or left, or if your body suddenly moves forward or backward or against gravity or with gravity, that part of the brain, that organ, can tell your brain about that angular motion. There's another part of the brain that is responsible for something called proprioception. Proprioception is the awareness of where your limbs are in space. So at any given moment, you know if your hand is here or here because of your proprioceptive sense. So that information is also given to that same region of the brain that gives you whole body awareness. So does vision, so does hearing, so does touch. In every muscle in your body, there are little receptors that tell your brain what the position is of that muscle. That information goes there. Also, fear. If you're afraid for any reason, that enters into whether or not you feel stable. So even if all the other information is telling your body that you're stable, but you're afraid, your brain is going to think, I'm not steady, I'm actually unbalanced. You might even feel a sense of dizziness. Let me give you an example. If you're afraid of heights and I ask you to go up on a 20-foot ladder and fix something, when you get up to the top of that ladder, if you're afraid of heights, you might very much feel a sense that you're falling. You might even feel dizziness. You're not dizzy. Your inner ear is not telling you you're dizzy. Your proprioceptive sense isn't telling you you're dizzy. Your limbic system is. Your limbic system is where fear comes from. So when the fear is high enough, your brain is going to think, I am not balanced, I'm actually dizzy. So why am I talking about all these things? For you to have a sense of balance, all of those things have to be okay. All of those senses have to be intact and giving you information that you're stable. So when you don't feel stable, it could be any of those systems that's giving you the wrong information. It could be that your inner ear isn't working right, or your proprioceptive sense isn't up to par. It could even be that maybe you just don't know how to walk on whatever you're trying to walk on, and so you feel unsteady. It could be fear. All of those things come together to give you that perceptual sense of balance. Now let's talk about functional balance. When I ask someone in my clinic to stand on one leg, I'm measuring their functional balance. They might not feel dizzy when they come in, but if I ask them to stand on one leg and they feel dizzy, that's them perceiving that they're dizzy. But if I don't see them lose their balance when they stand on one leg, then I'm going to say, well, functionally, they can stand on one leg. I might ask them to walk heel to toe on something. Again, I'm watching if they lose their balance when they do these things. I ask them to turn, I ask them to walk backwards. Those are all measures of functional balance. So when someone says they're balanced, they might be talking about their perceptual balance, how they feel, or they might be actually talking about their functional balance because they know, hey, when I try to walk on the grass, I lose my balance. Or when I try to walk backwards, I always am falling, or I feel like I'm going to fall. So it's really important to understand that those two types of balance, functional and perceptual, are really what we're talking about when the person is coming to me and saying, I'm having a balance problem. It could be either of them. It could also be both of them. How does a baby develop the skill of walking? One thing that we know from research is that humans are not born with the ability to walk. It's not something that we can simply be born separated from everybody else and learn the skill of walking on our own. Walking is something that requires parent intervention, and it requires an environment that allows the child to safely learn to walk again. One thing that we also know is that when you think about a baby, you don't take a baby to a gym and have them lift weights. You don't look at the child that's not walking and say to yourself, this child is weak, that's why they can't walk, so we're going to give them strength training. You also don't take the child and put it in a classroom and tell it, these are all the principles of walking, this is how you should have posture, this is where you should hold your arm or your foot, because that would be ridiculous. Babies don't understand that kind of instruction, and certainly a baby wouldn't be brought into an exercise class or given anything that would strengthen their arms and legs. We all are pretty much aware that a baby has enough strength to be able to stand. The question is, why isn't the baby initially able to walk? It's because the baby lacks the coordination and balance to be able to walk when they're in a standing position. So it's not a strength issue, it's a coordination, a balance, and sort of a programming issue. The child doesn't yet have the skill of walking. I have to ask, why when we look at an adult that's lost the ability to walk, do we automatically assume that they can't walk because they're not strong? I ask any new student of mine, any new employee of mine, look at someone with a stroke and tell me, why can't they walk? Why can't they get around? And the first answer they always give is strength. But when we look at the baby, we don't think that the baby isn't strong enough. We just assume that the baby lacks that skill. And I agree with that. That's the problem, is the baby doesn't have the skill yet and hasn't acquired the skill to walk. So another way to think about this problem is think about a young, fit, young adult who plays in sports, is highly functional, and has a sudden accident, a car accident, and suddenly, because of a brain injury, can't walk. It's not one that causes any kind of spinal cord injury. The muscles are just as strong as they were before, but the person can't walk because of the brain injury, because the parts of the brain that control coordination and balance and thinking are affected. So we wouldn't give that young, fit adult strength training because we know that really it's problems with his brain. And what we're hoping is that that young adult can relearn how to walk again. But when we look at an older person, a lot of times the tendency is to assume, because they're older, that the problem is strength. When just like a baby, the older adult has lost the skill of walking, not strength in the muscles as the limiting factor. Walking is a motor skill. We gain it through repeated practice. It's not something we're born with. It's not something that we're pre-programmed for. Walking is programming that we acquire by failure, repeated failure. The baby stands up and holds on to something and tries to let go, loses its balance and falls down. The baby stands up on 2 feet and tries to take the first step and fails and falls down. It's that repeated failure that teaches the baby, okay, if I do this or that, it's not going to work. So the baby eventually learns what's the right way to hold my leg, what's the right way to control this muscle, what's the right way to balance on one leg. It's through that repeated failure that the baby eventually acquires the skill of walking. I hope this video was helpful. If you want to see more videos like this, please subscribe to my channel.